Okay, and welcome to the Nurse Shark Academy show. And this is the nursing news you can use. And yep, this is what happened. I'm going to have to go ahead and get us fixed up here on Facebook again. I'm not sure what happens with Facebook, but this happens every week. So I'll take it out, move, remove, then add it back. All right, and so we're waiting for them, and yep, now we've got the blue checks, and we're good to go. And welcome to Nursing News You Can Use live at 5. I'm Tina Baxter, your host. Today is January the 31st, 2024, and it is the last Wednesday of January 24. I want to welcome all of you that are watching us on our Facebook channels, the Nurse Shark Academy page and the Baxter Professional Services page, and welcome then also to those of you that are on our YouTube channel. Thanks for tuning in. We're going to go ahead and get started, and I'll just hit the button here. My mission is for you to own your seat at the table of nurse entrepreneurship, gaining confidence, skills, and freedom to live your life on your own terms. I specialize in working with nurses and other health professionals who want to reduce burnout, pessimism, and compassion fatigue, so you can become a successful entrepreneur to reclaim the love you have for your profession and to create a fulfilling and prosperous life. Join the Nurse Shark Academy at thenurseSharkAcademy.biz and come feel the sun, providing a clear path for business success. Okay, so, all right. So let's get started with our affirmations for today. Our first affirmation: I am so grateful for all the good in my life. The gifts I share are returned to me multiplied many times over. I am so grateful for all the good in my life. The gifts I share are returned to me multiplied many times over. Number 2, water is my favorite beverage. I drink lots of it to cleanse and energize my body and mind. Water is my favorite beverage. I drink lots of it to cleanse and energize my body and mind. And I do have to agree, I drink water mostly every day. And then lastly, I deserve to have personal happiness, and I accept it now. I deserve to have personal happiness, and I accept it now. Those are affirmations for today coming from the Louise Hay I Can Do It calendar that we received new this year from a gift from a friend. And so this is what we'll be using our affirmations for this year. So thank you. All right, we're going to get into the news because there is a lot. There is a lot to cover as usual. I say this every week, but there happens to be some things happening, and I wanted to share that with you all. So let me pull up our news segments. And while I'm doing that, I do want to say I had some great conversations today. I had great conversations with some people. I met this wonderful woman who happens to be in the network marketing business that I'm in as well as doing some other great things. We had a great conversation about how we can help one another and learn from her. And then I had another conversation with a great nurse that has agreed to come on the other show, the Nurse Shark Academy show, where we interview nurse leaders. And so I'm excited that she's going to be a part of that as well. So I say this to say, having those great conversations is important. If you're not out there networking and meeting people, I encourage you to do so. It's so important to talk to people and get a bigger perspective of what our world is like, and to hear from other people and what they have to share and offer. And I am so grateful for the relationships that I have had. So let's go ahead and start with this story. So this story is coming out of Iowa. And it says, out-of-state staffing agencies misclassify nurses as gig workers in Iowa skilled nursing homes. So this, I believe, came from the Iowa Dispatch. And it says, Iowa nursing homes are too often relying on temporary staffing agencies that misclassify workers as independent contractors. It's time to shed light on the alarming misuse of temporary gig workers misclassified as independent contractors in Iowa's nursing homes and assisted living facilities. After years of development and public discourse, the U.S. Department of Labor has issued groundbreaking rulings that definitively classify more workers as W 2 employees rather than independent contractors. And those of us that are running businesses, this is important. This is what we need to know so that you're not misclassifying the people that work for you. It says this marks a pivotal moment for skilled nursing facilities and assisted living facilities in Iowa, where concerns about the shortage of qualified staff persist, leading to subpar resident to staff ratios, according to the article. It says Iowa has consistently ranked poorly in nursing home facility resident to staff ratios, intensifying the urgency to address the issue. To cope with the staffing shortages, facilities often turn to staffing agencies, relying on them to provide W 2 caregivers to ensure residents receive the quality care they deserve. However, a disturbing trend has emerged with some temporary staffing companies classifying certified nursing assistants, LPNs, and RNs as independent contractors, a practice that has far reaching consequences. So let's get into it because we've talked about working that those travel nurse assignments and these independent contractor or these staffing assignments, I should say. What does this mean? Okay, for the individual, for the nurse, not just for the agency that they go to, but for the individual nurse. And so it says a handful of companies established around the time of the pandemic have lured applicants with promises of higher pay while avoiding the legal obligations associated with W 2 employment. These companies, by classifying workers as independent contractors, sidestep providing necessary insurance coverage and paying unemployment taxes to the state. So this is the same way that you would see maybe Uber and Lyft drivers and things like that, which they've had um, similar complaints, right? And so this is something that we need to think about and think through. So if you're getting one of these contracts as a nurse, you might want to take a look at the fine print. And I'm not saying it's good or wrong, good or bad. I'm just saying that what does that mean for you as an individual? Because if you're classified as an independent contractor, then you need to know you have to pay your own taxes. And a lot of people don't understand that. It says these companies also are not required to take tax deductions for federal or state taxes, which can jeopardize the financial well-being of their staff stuck with a large tax bill at year end. The allure of lower bill rates may tempt facilities to engage these agencies, but the potential risks are significant and far-reaching. It says misclassifying temporary caregivers exposes facilities to unforeseen legal and financial risks. In the event of a serious medical error, the facility can be held liable for the actions of an independent contractor, resulting in potential $1-million legal settlements. And so this is another issue that comes up and has been coming up more recently as we're talking about the medical directors that are contracted to provide that service for nursing homes. They're often listed as independent contractors and don't necessarily work for the nursing home. So if there is a medical error, then who's at fault? Is it the independent contractor physician? Is it the facility that should be on the hook? Those are questions that need to be answered that I can't answer here. But those are some of those questions that have been coming up as of late. So the facility may also find itself named as a co-employer and held financially responsible, held responsible for failing to withhold taxes correctly or paying overtime wages. So again, this is not something that I'm picking on the nursing homes for, but these are legal things that are coming up and financial risks that facilities haven't thought about. And maybe, what's happening in Iowa, I know it's happening in other places. So it says companies engaging in the misclassification of caregivers in Iowa's nursing homes operate from outside the state, posting jobs for assignments for various facilities. Recognizing the urgency of this issue, the Iowa Coalition Against Nurse Misclassification, a coalition of 15 Iowa-based companies, has united to bring attention to regulators and legislators. The recently released U.S. Department of Labor ruling on classifying workers as independent contractors is a welcome development, promising more efficient and timely enforcement of violations by facilities in Iowa. House Republicans in Iowa have demonstrated a proactive commitment to safeguarding the state's nursing homes and healthcare institutions. Their prioritization of this issue underscores the need for the comprehensive and collaborative efforts to combat the challenges posed by these out-of-state staffing 1099 staffing agencies. So this brings up those questions. And so if you're running a staffing agency, then as many nurses have started to do in the middle of the pandemic, and this is great. But knowing what these rules are and how they can affect you and your bottom line as an agency is very important. So there's more to this story, and I'll be happy to share all of this with you. But you can certainly get this from the Iowa Dispatch, and that was a great story that they had. There's more, but I can't read it all. But you kind of get the gist of it. So if you have any comments, hey, let me know. And if you've ever worked for these companies and experienced that, let me know. I was in independent practice, and I worked in a private practice where I was an independent contractor. And because I had that, I had to pay my own taxes. And so I, had to get with my tax preparer and an accountant and really look at how best to navigate this because I wasn't in the traditional W-2 employment setting. The same as if you are working for yourself as a business owner, you still have to pay your own taxes. And so these are things that you need to look at and remember and make sure you're classifying your employees the correct way. All right. Let's move on. Here's another story. This is coming from the American Hospital Association, and I just happened to see this today. It says at AHA briefing, hospital leaders urge Congress to pass the SAVE Act and protect healthcare workers from violence. So it says members of Congress and hospital and physician leaders January 30th highlighted at a Capitol Hill briefing how the bipartisan Safety from Violence for Healthcare Employees, or SAVE Act, would help protect healthcare workers from violence, alleviate workforce challenges, and sustain quality patient care. The AHA supported legislation would provide federal protections from violence for healthcare workers similar to those applied to aircraft and airport workers. Opening the briefing were Representatives Larry Bucshon of Maryland, Larry Bucshon, MD, Republican from Indiana. I apologize for that. And Madeline Dean, Democrat from Pennsylvania, sponsors of the House bill. Sorry, I read that wrong. The panel comprised Mark Bocott, President and CEO, WVU Medicine Garrett Regional Medical Center, and WVU Medicine Potomac Valley Hospital, Kate Fitzpatrick, DNP. Ooh, great to have a nurse on there. Executive Vice President, Connolly Foundation and Chief Nurse Executive Officer, Jefferson Health, and Aisha Terry, MD, President of the American College of Emergency Physicians and Associate Professor of Emergency Medicine and Health Policy for George Washington University School of Medicine. Again, I'm very happy to see nurses represented on this. So Fitzpatrick discussed the cumulative effects of workplace violence on employees. It comes out in a lot of different ways, she said. People get depressed, have anxiety, feel low self-esteem, and have other challenges such as sleep disorders or high levels of absenteeism. All of this is really impacting our healthcare infrastructure. Healthcare employees are the safety net of healthcare for the country, Terry said. We know for sure that workforce safety is linked to patient safety, and therefore, in order to ensure that we're able to provide patients with the care that they need, we have to get them some help. Boycott said some might think his hospital is less prone to workplace violence just because it's in a rural area, but that isn't the case. He says for people who work at our hospital, this isn't something they want to talk about. They would rather try to sweep it under the rug and move on and think of how we're going to take care of the next patient. I think that has created a sense of acceptance that it's part of the job and it really shouldn't be. The AHA and the American College of Emergency Physicians co-hosted the briefing, which was attended by nearly 100 House and Senate staff. So we'll see what happens with the SAVE Act, and I am in favor of anything that can move that needle forward and keeping our workers safe and ultimately keeping our patients safe. All right, so here's another article. I just wanted to share this. This article is talking about Cigna. This came from Reuters. And it says Cigna sells Medicare business to healthcare service for $3.3 billion. Let's get into it. So, Insured Health Care Service Corp said on Wednesday it would buy Cigna's Medicare business that manages government backed health insurance for people 65 and older for $3.3 billion in cash. The sale consists of Cigna's Medicare lines, including Medicare Advantage, Medicare Supplement, and Medicare drug plans, as well as a unit called Care Allies that works with physician groups and other healthcare providers. The divestiture marks a change in Cigna's strategy for the sector it had entered with its $3.8 billion acquisition of HealthSpring in 2011. Healthcare Services holds a license to provide Blue Cross Shield insurance plan in 5 U.S. states. It employs more than 27,000 people and 18.6 million members. The vast majority of Cigna's revenue comes from its commercial business and pharmacy benefits division, which is bolstered with $52 billion purchase of Express Scripts in 2018. Cigna's Medicare Advantage business generated 4.4% of the company's $179.4 billion revenue from external customers in 2022. Its plans currently serves 3.6 million Medicare members. So again, healthcare service then has a larger piece of the pie when it comes to Medicare. And so it probably makes sense when it doesn't make up bulk of their revenue to offload that given the current changes that are happening. So the deal is expected to close in early 2025. So we'll see what happens with that. But that was a bit of news that came out today as well. Okay. Here's another story. Healthcare workers react to loosened restrictions on physicians' assistants. This is out of Rochester, New York. And it says the governor, Kathleen Hochul's new budget proposal, she's looking to loosen some restrictions on physician assistants so they can practice without supervision by a physician. Medical practitioners say this will increase access to care. There's a healthcare workforce shortage, and according to research by the University of Albany, that's expected to get worse by 2030. Hochul's new proposal would loosen restrictions on physician assistants so that they can see more patients without supervision. Taylor Devereaux, a physician assistant at Rochester Regional Health, said, "We take very seriously the care that we render, and we want to ensure that the care that we are rendering is the highest quality, it's safe for the patient, it's cost effective, but ultimately the patients still need to be seen." Currently, one physician is able to supervise either up to four or up to 6 PAs, depending on where they work. If passed, this would eliminate that administrative barrier. Although this would allow PAs to work autonomously, the proposed change wouldn't broaden the scope of a PA's job. So I guess this is a great win for the physician's assistants, and it seems like the people mostly there are pleased with that. And it's noted that during the pandemic, there was executive orders that allowed the PAs to practice to the fullest extent of their training that ended last summer. And so it goes on to say that timely care yields better patient outcomes. So if we allow PAs to create access points unburdened by bureaucracy, that they're going to be able to provide efficient, timely, cost-effective care, which is going to improve patients' quality and outcomes. And it was noted in this article that nurse practitioners have had this autonomy since 2022. All right. So this is coming out of Washington, Massachusetts, Maine. It says Washington County nurses protest local hospital staffing practices as contract fights heats up. So dozens of nurses employed with Down East Community Hospital held a rally Saturday. This was back January 27th. So Saturday would have been, the 27th. In Machias to protest staffing issues amid stalled contract negotiations between the nurses union and the hospital. While not on strike, those in attendance had clear demands. They said, "We're looking for safe staffing and staff retention." So Very important, said Roberta Alley, the chief representative of the union Maine State Nurses Association. Much of the concerns raised by the nurses had to do with the hospital hiring travel nurses who are often better compensated than full time staff. The concern is the here then gone employees aren't as effective at bringing patient care to the unique population of Washington County. They say the people here know how to treat our people. When you're from away, you don't know backgrounds and how to treat people, said Kirsty Simmons, a negotiator for the union. To remedy this, the union is asking for a contract that devotes money and resources toward incentivizing local nurses to work at Down East Community Hospital. The goal is to, quote, bring some of our local nurses back instead of utilizing travel nurses and to retain the excellent nurses we already have. The hospital, however, disagreed with the demands, according to a report published on Friday. A hospital spokesperson had told the public media outlet that travel nurses are part of solving the staffing issues, and the concerns during the rally are typical union tactics during negotiations and nothing more. So we'll see what happens with this, but another union possibly going on strike. This I found interesting. Gallup just published this, and we're going to get into another Gallup story, one that you've probably already heard of. But I found this is kind of interesting. This was just published today. It says few Americans know how much their health care costs. Yeah, I'm a healthcare provider. I don't know how much the healthcare costs. To be honest with you, I really don't. I look it up. For medications, for example, I often look up the medications on websites like the prescription discount plans and find out what their costs would be. And it's kind of interesting to see, hey, this medication, if you buy from this pharmacy, is going to cost you $50. But if you go down the street to this other pharmacy, it's going to cost you $10. But if you go to this other pharmacy, it's going to cost you $500. I mean, you can see various prices. It is kind of wild out there. So this is coming out of Gallup, and it says 17% of U.S. adults report they know how much their healthcare products or services will cost before receiving them. Results are similar across key demographic groups, including by race and ethnicity, gender, age, education level, geographic region, and healthcare insurance coverage status, suggesting a society-wide lack of awareness about one's healthcare costs regardless of personal background. While fewer than 1 in 5 Americans report they know the cost of their healthcare products or services before receiving them, 95% believe healthcare organizations should make these costs more transparent before providing care. Results are consistent across all major subgroups of the U.S. adult population. It says most Americans do not believe the quality of healthcare products and services they receive reflects the cost they pay for their care. Only about 3 in 10 feel the cost of their healthcare products and services reflects the quality of those products and services, and attitudes are similar across subgroups of the U.S. population. So Americans' concerns about transparency of their healthcare costs are reported amid record healthcare spending. Federal reports indicate that the U.S. healthcare spending grew by 4.1% in 2022, reaching $4.5 trillion or $13,493 per person. At the same time, a record high percentage of Americans report they have had to put off their medical care costs. Results from the Bentley Gallup Business and Society report suggest that Americans are increasingly wanting but are lacking important information about the cost of their healthcare services, even as prices continue to rise. So we see this has been one of the issues and the problems. So here's another story that I just happened to find that I thought this is kind of tragic. This is really tragic. Let me see if I can find it real quick. Yes. This happened to me on my news feed, and I just picked it up and saw it. This was coming from CBS, WTAQ News Talk, and it says, "Man seeking health care convicted of robbing Green Bay Bank. This is out of Wisconsin. It says Mark Vogel was convicted Wednesday of robbing a Green Bay bank, who told police he wanted to get caught so he could get health care. Sentencing is set for June 4th, according to court records. It says Vogel, 63, which, let's stop here. If he doesn't have a job, he may not have health care. He may not qualify for Medicaid if he works too much, or maybe he's in a job that doesn't provide health care. He may qualify for the marketplace health care, but he may be priced out of that if he makes too much to get subsidies. And he's not 65 yet, so he doesn't qualify for Medicare. So this is how this could happen. So I just wanted to put this in the context of the story. So it says Vogel, who's 63, was charged with robbery of a financial institution after the January 8, 2023 robbery of the BMO Harris Bank on 201 South Military Avenue. Police were called to I think he's supposed to say to the bank at 4:45 p.m. A short time later, Vogel was arrested while still on the same block. The mail stated, this is what the complaint says, "Here's the money, I did it." He was asked why he tried to get caught, and he stated that he has a lot of health problems and he didn't have health insurance. Vogel stated that he wanted to get caught to get health care. He left the bank with $1,761, which was recovered, the complaint says. He also apologized for his actions. And that's the sadness, that someone has to go to that length to access our health care system. That is really sad. Okay. So let's talk about this next one. This is about HCA. This is an article that was put out by Healthcare Finance News. It says HCA plans on $5 billion in capital spending this year. So CEO Sam Hazen has said, "I will tell you that we do have a large development pipeline of new outpatient facilities that are connected to our capital project in 2024 and 2025. It says we'll have quite a few come online, a little bit more than we had in 2023 and 2022. We do have some new hospitals in a few markets that will come online." He also says they are starting to invest in other markets. There's a growing occupancy on the inpatient side, and then we have opportunities in the outpatient side to expand our networks further in these fast-growing communities. Allocations between inpatient, outpatient, and technology will be consistent with past years. Consistent allocation of capital has yielded strong returns, he said. It has allowed us to meet the demand expectations that exist in the market, and it also is responded to our physicians in a way that have created the capacity or allowed for the clinical technology need to practice their medicine. Okay. The first in network expansion in facility services and workforce, with over $2 billion of new capital projects scheduled to come online that will increase capacities. The second opportunity includes a robust agenda designed to advance digital capabilities across the company. Among the benefits, this will improve the company's overall operational management capabilities, integrating revenue cycle and case management functions better. The third area is to invest heavily in the business and people while also allocating capital to shareholders. So we're going to see what this means. So in 2024, they plan to increase their spending to over $5 billion and enhance our share repurchasing program to around $5 billion. So the article goes on to say why this matters is that HCA finished 2023 better than expected across most dimensions of its business. Reported Q4 net income attributable to HCA Healthcare was $1.607 billion compared to $2.081 billion during the same quarter in 2022. In 2024, net income attributable to HCA is expected to range between $5.2 billion and $5.6 billion. The volume of beds coming online in 2024 is about the same in 2023. ER capacity is growing consistently. So we will see what's happening with this and these new developments. But that's to kind of get you a picture of what's happening. Remember, we talked previously about how hospitals have to spend a certain amount of money, and part of that is making capital improvements. Okay. Oh, yes. This is a story we've been following for a while, and I just thought I'd share this with you. This is from Skilled Nursing News. And this is about two other nursing home owners that have been linked to fraud. This is coming out of New Jersey. And it says two more nursing homes in New Jersey have had their Medicaid funding suspended following allegations of massive fraud by the owners related to their New York facilities. Deptford Center for Rehabilitation and Healthcare and Hamilton Center for Rehabilitation and Healthcare will lose their Medicaid funding on May 24th, according to the office state controller and reporting for the NewJersey.com. There are currently 200 and 156 residents at Deptford and Hamilton, respectively. The facilities will need to appoint a monitor or take similar action to transfer control of Medicaid funds away from the current owners, Kenneth Rosenberg, Beth Rosenberg, and Daryl Hagler. Kenneth Rosenberg is co-owner of Centers for Healthcare, and Hagel is co-owner of properties with Rosenberg. They go on to say that they will continue to, Jeff Jackelman, spokesperson for the center, says, we will continue to fight the New York Attorney General's spurious claims and respond to the New Jersey copycat claims in due course. So they're not really commenting on that. New York Attorney General Letitia James accused the owners in a lawsuit of siphoning $83 million from the nursing homes funded by Medicare and Medicaid to enrich themselves, their relatives, and associates. Evidence of repeated and persistent fraud was so credible that a New York State Supreme Court judge last July appointed a financial monitor and health monitor to assess and manage operations. New Jersey Department of Human Services Communication Director Tom Hester says the core of Medicaid's mission is to deliver quality care. There should be no question about health and safety of our long-term care residents or about the proper use of government program funds. The goal is and always will be quality care through holding operators to the highest standards. So we'll see what happens with this story. This comes on the heels of, we've talked about these before, heels of Gail and Ezra Bogner, also nursing home operators in New Jersey who were suspended from the Medicare program last week. The Bogners own the now defunct Princeton Care and Woodland Behavioral Nursing Care Center. Yet another facility in the state, Limecrest Subacute and Rehabilitation Center, was at risk of losing its Medicaid funding unless a buyer stepped in. The owners informed the state that they plan to sign a contract for sale on February 1, according to NewJersey.com. So, again, those are some of the things that are happening in long-term care news, and I thought I'd bring that out. Thanks to Skilled Nursing News for their wonderful reporting. So let's look at that because we talked about this before. The Indianapolis Star did a wonderful job of an article a year or so ago about the funding for nursing homes and how this happens. And we certainly bring this up. But when you have nursing homes that are held privately, a lot of times you have to look at where is the money going, and that's where a lot of this is coming from. Is that the money should be flowing back for patient care, for staff, etc. But a lot of times there are bad actors, and we certainly cover all those cases where they kind of siphon that money off for their own purposes, allegedly. Okay. All right, so here's another story. Oh, this is the other one that everybody heard about by now, but just in case you did not hear, this is what you need to know. This is from MedPage Today. Nurses are still the most trusted profession. Doctors fall to fifth. Okay. It says nurses remain the most trusted profession in the U.S., while medical doctors drop to the fifth spot, according to Gallup's 2023 Honesty and Ethics poll. Out of 23 professions, 78% of surveyed adults rated nurses as having very high or high honesty and ethical standards, while 56% said the same for medical doctors. But the degree of trust across nearly all professions has fallen, with the percentage of doctors down 6 points versus the year prior, when it's held at second spot in the rankings, and the percentage for nurses 7 points lower than in 2019 and 11 points lower than its peak in 2020. Rania Latornu A PhD RN, executive director of Florida Center for Nursing, says nurses are an essential part of healthcare. Nurses spend more time with the patients than any other healthcare provider, and patients can trust the person who is at their side. While nursing is still rated the most ethical profession, last year's rating was down due to the lowest level since 2004. And that might be in part to things like allegations of fraudulent nursing programs, which we all know about the whole Operation Nightingale. So, attorneys stress the importance of addressing unethical behavior in our profession and implementing strategies to ensure it does not continue, while also promoting nursing excellence programs and the positive image of nursing. So, I think that's wonderful. So, nurses were trailed in 2023, polled by veterinarians at 65%, engineers at 60%, placed second and third, dentists at 59%, and pharmacists at 55%. Of course, on the opposite end of the spectrum, advertisers, um, car salespersons, senators, quite interesting, all landed in the single digits for trustworthiness, with members of Congress dead last at 6%, according to the poll. That is not shocking. Okay, so if you want more information for this, you can also check this out on Reuters, and not Reuters, on Gallup's website, but also on MedPage Today. So that was kind of an interesting little take there. Okay, this article just showed up today as well. I was just scrolling my phone and I happened to see this one. And yeah, this was kind of interesting. This came from a news break. So there you go. And it says, according to Newsbreak, syphilis cases rise sharply in women amid alarming resurgence. And so I wanted to share that because, hey, gals, let's be careful out there. Nearly a quarter of syphilis cases in the U.S. were being diagnosed in women in 2022. The Centers for Disease Control and Prevention reported Tuesday in a sign that the nation's alarming epidemic of sexually transmitted infection is increasingly spread among heterosexual couples. The number of syphilis cases reported in women climbed 19.5% in 2022. In all, there were 14,652 cases of primary and secondary syphilis, with the first two stages of the disease reported in women, making up roughly a quarter of the 59,016 cases nationwide. In 2018, just 14% of the syphilis cases have been reported in women. Okay. So, health officials have warned for years about the nation's worsening syphilis epidemic. The CDC's final figures for 2022 are the largest number of diagnosed nationwide since the 1950s. While tens of thousands of syphilis cases and deaths used to be reported every year in the 1940s, the rollout of penicillin led to steep drops in the rates of the disease over the last century. Cases last peaked nationwide in the 1990s before a years-long decline, the health officials say, that was likely driven by changes in sexual behavior due to the HIV epidemic. So syphilis rates have increased every year since 2011 and remain disproportionately high, especially among Black and American Indian populations. Merman said improving diagnosis and treatment efforts, as well as redoubling efforts to curb other factors like substance abuse that lead to risky behaviors, enabling the bacteria spread, will need to stop the epidemic. So this is an interesting story. You can certainly read more from the CDC on regards to this, but I just want to bring that out as a public health service announcement there. And it's curious to see what our responses are going to be locally, and definitely we'll take a quick peek into that and find out if this is something that we need to worry about here locally in Madison County. All right. Here's another sad story of a nursing home closing, and it says Turlock Nursing Home closure leaves residents desperate for a place to live. Turlock Nursing Home that has a 145 bed capacity announced that it's shutting down due to operations costs that are just no longer financially sustainable. Brando Manor in Cypress Assisted Living will be no more. Its 85 remaining residents will have to figure out a different place to live. I don't know where I'm going yet. I'd like to stay in this area, but I don't know if that's going to be available because there's only so many beds, says an 8-year resident, Glenda Takar. It's a tough situation for Turlock seniors as facilities nearby are filling up fast and many people are on waiting lists. She says, I was put, oh no, Galen Cornell, daughter of a resident, said, I was put on a 1 year long waiting list, and that's what I'm being told down the line. Waiting list. There's nothing I can do. Cornell told CBS 13 that she's been constantly making phone calls to find a bed for her mother. She's been told that Sacramento County, Bay Area, and because of my own health problems, are not going to be able to ever see my mom again if they send her that far away. So unfortunately, this is going to bring down the number of beds that are available in that area, and it's just very sad to hear of another facility that has gone under and these residents being displaced. So my heart goes out to them and their families. Okay, this next story looks like it comes from ABC News. Says uh, victims of Ponzi scheme, Haverhill mayor says of Stewart's financial crisis in Massachusetts. It's coming out of Massachusetts. It says state leaders are working to fill anticipated gaps since once Stewart Health Care moves forward with plans to shut down hospitals, including New England Sinai Hospital in Stoughton, Massachusetts. The Department of Public Health is holding a hearing Wednesday at 6 p.m. on the plan to close the facility. The acute long-term care and rehab facility is scheduled to close by April 2nd. Last month, the embattled healthcare system lost $22 million on hospital operations. Haverhill's mayor said employees and patients are already feeling the weight of Stewart's financial crisis. It says for months, the janitorial service, those folks were buying toilet paper for patients with their own money. This is an unbelievable situation we find ourselves in. I think we are perhaps the victims of a Ponzi scheme, Haverhill Mayor Melinda Barrett said. Haverhill City Council President said a Stewart representative told him the hospital will not immediately close. Officials are hoping for an official update this week. Stewart employs more than 16,000 nurses, doctors, and other frontline essential healthcare workers in the state. This is sad to hear of a hospital closing, and we're going to keep an eye on these developments as they go across the country and see this stuff happening. And this is our other story here. Worcester Hospital nurses file complaints over dangerous conditions. Nurses at St. Vincent Hospital in Worcester have filed official complaints with the Massachusetts Department of Public Health and other state agencies over, quote, dangerous conditions they say jeopardizing patient safety, the state's largest nurses union announced Tuesday. The complaints are based on over 500 reports made by nurses over the last 6 months that details issues such as staffing deficiency and poor allocation of technology. The Massachusetts Nurses Association, or MNA, which represents the nurses, said in a press release. The reports, over 100 of which were filed in January of 2024, also describe, quote, a deliberately punitive management culture that is causing delays in delivering patients' medications and treatments, preventable patient falls, and even preventable patient deaths, according to MNA. By allowing these problems to persist, the union claims Tenet Healthcare, the Dallas-based healthcare company which runs St. Vincent, has violated state patient care standards. According to Marlena Pellegrino, a nurse at the hospital and an MNA representative, we are sickened to report, but find ourselves duty-bound to do so, that the conditions documented in these complaints raise serious concerns about the safety of patient care at our hospital. As the complaints show, our administration has created an environment that too often violates the dignity of our patients and compromises our ability to meet accepted standards of patient care. Nurses have been concerned about conditions at St. Vincent's for years, the MNA said, but the situation has become worse over the past year after a new chief nursing officer, quote, implemented a concerted campaign to cut staffing levels and increase nurses' patient loads in blatant violation of the nurses' union contract. Notably, the contract ended a 10-month-long nurses' strike orchestrated by the MNA that ended in early 2022. According to the MNA, the hospital's emergency department is the nurses' greatest concern. Despite the new contract requiring that at least 12 nurses to be on duty at all times, the hospital cut over half the department's nursing staff, often leaving just 4 or 5 nurses on a night shift to handle a busy urban emergency department, the union said. Nurses in the department are often responsible for as many as 15 patients at a time, even when patients are critically ill, needing constant monitoring, or have behavioral problems, the union said. Additionally, the MNA claims that there is often no nurse available to triage patients. The resolution presented by the hospital administrators was, quote, hoping the patients would be discharged so that the new patient could be given a monitor, the union said. In the meantime, the admitting doctor was told to cancel the order for the monitor. So this wasn't a case, and when a patient needed heart monitoring, was admitted to St. Vincent, even though the hospital didn't have any monitors available. Additionally, the MNA said, nurses who raised concerns have been met with retaliation and have had their union rights violated. The union claims that 3 such nurses were fired and 6 others were put on leave without pay this month. As such, the MNA has also filed an unfair labor practice charge against Tenet and is asking the nurses to be reinstated. So we'll see what happens with this story, and we'll continue to follow what's happening in Massachusetts. Okay, and here's another one of our story. And this is a happier story, a good story in some cases. Okay, so it says Mercy University School of Nursing awarded $20,000 to address racism in the profession. Mercy University School of Nursing was awarded $20,000 to address racism in nursing. Mercy was one of 10 winning proposals selected from the more than 130 submissions to receive funding from the American Nurses Association. A national survey of more than 5,600 nurses conducted by the commission shows that racism is a problem within the profession. University officials say the grant will enable Mercy to develop programming that facilitates the transition of nurse educators into the role of health equity influencers. So we'll see what that means and how that's rolled out, but okay. Given that we had racism declared as a public health threat here in our city, because it still is very much so, and we've had research studies. We talked about this of biases that we have, and so as healthcare providers, I think it's important that we address that and we think about that. All right. And let's get on to this one. Oh, yes. Let's not forget this. This I found interesting. So this is a story about a nurse in Wichita Falls. A woman who posed as a nurse in Wichita Falls. So the Board of Nursing has warned citizens of a woman accused of posing as a registered nurse and practicing in 2 Texoma cities. Jessica Renee Judd was named in the imposter warning section of the January 2024 edition of the Quarterly Texas Board of Nursing Bulletin, a newsletter published every 3 months. According to the publication, Judd also goes by Jessica Morse, Jessica Fogelson, Jessica R. Judd, Renee Judd, and Jessica Judd. The publication said that Judd secured employment and practice as a registered nurse at a hospital in Wichita Falls from June 1 of 2020 through January 26 of 2021 by using the license number belonging to another nurse with the same name. Officials with the Texas Board of Nursing said during this time, Judd provided skilled nursing care to patients and represented herself as a registered nurse to staff, patients, families, physicians, and the public while using the credentials of RN on medical and business records. In addition, the publication said Judd secured employment and practice as the director of nursing at a nursing home in Jacksboro. She's also accused of falsely practicing as a nurse at a treatment center in Weatherford and a nurse supervisor at a clinic in Decatur. According to the publication, the board's investigation revealed the birth date and social security number Judge gave the employers did not belong to a nurse having a license to practice in Texas. And it says, according to the publication, the case has been referred to the Wichita County District Attorney's Office, the Wise County District Attorney's Office, the Parker County District Attorney's Office, and the Jack County District Attorney's Office for prosecution. So I bring that up to be careful, nurses, if you want to monitor your license and making sure that nobody's fraudulently practicing under your license. This is important. Identity theft protection is on the rise. That's why I continue to bring this story, is because your license is your business, and you need to really think about this and how to protect your license. And so our last story is our nurses making a difference, and this is a great story. This is about the Black Angels. Nursing heroes of tuberculosis care were honored in Staten Island's museum exhibit. A new exhibit or exhibition at the Staten Island Museum, Taking Care, the Black Angels of Seaview Hospital, explores the groundbreaking work of Black nurses who broke racial barriers and risked their lives to care for tuberculosis or TB patients and administer clinical trials in the earliest 20th century. As a person who teaches on TB basic validation and having classes, this part is near and dear to my heart because I do want to help others in that area. So I think this is awesome. It says, through historical objects, archival images, oral histories, and a meditative art installation, the exhibition explores the lives and legacy of the Black Angels, 300 Black women who cared for more than 2,000 patients after a large group of white nurses staged a walkout at the 2,000-bed sanitarium in 1929. So this isn't new, having these walkouts. It says, their work forever changed the trajectory of a horrific disease, which is the world's second deadliest infectious disease behind the coronavirus, according to Johns Hopkins Bloomberg School of Public Health. In 1951, TB wards were dangerous places to work. The nurses at Seaview spent decades caring for patients sick with a contagious and incurable disease. They were integral to drug trials that ushered in a new era of groundbreaking treatment for TB. This moving exposition gives visibility to the Black women who made history on Staten Island by risking their lives to treat highly contagious tuberculosis patients and administering clinical trials, said Janice Munger, president and CEO of the Staten Island Museum in Livingston. The exhibit honors these extraordinary women, she said, highlighting the importance of healthcare workers. And because of that, I do want to kind of flash and show you the picture. I think this is awesome to see this picture. So let me go ahead and bring that up onto the screen. Share screen. Share a window. I want you to be able to see that. Look at these women. These nurses, people's mothers, grandmothers, Dora Tucker Jones, Annie Smith, Nellie Mae Holmes, Hazel Pedro Herring, Clemmy Phillips, Janie Williams, Molly Savage. I want to say their names. I think this is awesome. So I'm going to go ahead and start to share. Okay. So on display are the heirlooms on loan for the nurses themselves and their families, such as Bellevue School of Nursing cap on loan from Nurse Curleen Jennings Bennett, Nurse Kate Gillespie's name badge on loan from her grandchildren, and Harlem Hospital School of Nursing yearbook on loan from the Thurston Grooms of the class of 1951. Also featured are objects on loan from the Seaview Hospital's own historic collections and those of historic Richmond Town, as well as oral histories documenting the experiences of Seaview nurses, administrators, and descendants. So I think that is wonderful that they have this. And this is just awesome that these nurses, and it says, in a poignant twist of history, 93-year-old Virginia Allen, a revered Black angel who once served tuberculosis patients, has come full circle to reside on Seaview's campus, the very facility where she dedicated her service. So I just want to say these are wonderful nurses that are still, those that are still living, into their descendants. You are all nurses making a difference, and I'm very proud to be one of you. All right, so that will end our segment for today. I want to thank you for tuning in, and then let's get into some announcements. So we do have some very brief announcements. So coming up on November the 14th. Yes, it's Valentine's Day, but you also have a chance to get your CPR training done. So sign up for Baxter Professional Services Health Education and get your CPR training. If you need a full class, this is for you. So nursing students, you need to get your CPR done before you go to clinicals. Let's get it in there and get it done. And then also, we have our basic TB validation class will be at 3 o'clock. So you can sign up on Baxter Professional Services Health Education.com for those classes. So I love to always remind people of that. And then on February the 28th, we'll be having our CPR recertification class. So you can sign up for that class as well. So those nurses that need to get recertified so you can continue to work and do the wonderful things that you do, hit me up. Go to Baxter Professional Services Health Education.com to register for those classes as well. So that's what we have on our calendar. We also have some other events that are coming up on February the 7th. That's next week on Wednesday. We'll be having our Alignable event, our Lunch and Learn. So you can go head over to Alignable for our Anderson Alignable Alliance and sign up for that for our small business event. We're going to talk about how best to use Alignable and to further your small business needs. And we'll have a great time for that. And then we'll have other events coming up as we go throughout the month. So I'll be happy to share those events. So you can always get to our events from the NurseSharkAcademy.biz and Baxter Professional Services Health Education.com. All right, that ends our segments for today. Thank you for tuning in. And just know February, we're going to be hitting the ground running and going strong because we'll be having some additional events that are coming up specifically just for nurses. And then also, I am going to be participating in a senior care summit, and so you'll be seeing that information. Our new blog post just dropped today, so head on over to the NurseSharkAcademy.com to check out our new blog post, and we're going to talk about your B attitudes, and we're going to talk about being calm. And so that is in our new blog post, and then of course our latest Nurse Shark Academy episode just dropped as well, so you can be sure to head over for that at NurseSharkAcademy.biz. And as always, I want to thank you for tuning in every week. Don't forget to like, subscribe, hit that notification bell so you know every time that we go live on our YouTube channel, and then also share our content so that we can get other people involved. If you have news stories or you have something happening in your local community and you want me to give me a shout out, just let me know, send it to me, be happy to do it. All right, bye-bye for now.